Okay, good evening, everyone. This is Christina Campbell, and I am so glad to be here. I'm really going to dive deep. I'm going to give you a class that I gave many years ago. I used to teach this all the time, to how oils can help in nursing home settings. So what I want you to do is I want you to look at these oils in your setting, not necessarily a nursing home setting, but in your setting. And I'm going to give you a lot of research. And I think you're going to really, feel like you've learned something tonight. So let's get started. First of all, therapeutic grade essential oils are effective for many things. They're good for mood changes. They're good for increasing or decreasing appetite. And I'll give you a couple of little facts about that. Sleep, it's good for sleep. It's good for behavioral issues, weight loss, wounds, infections, colds, and flu. Essential oil quality. I'm sure that you guys know that not all essential oils are created equal, right? Many, if not all, the oils on the market are what we call perfume quality or fourth or fifth quality oils. These are overprocessed. They're chemically laden. I'm going to put you guys on mute because I hear some background stuff. And if you want to unmute yourself, you can. They're overprocessed. They're highly adulterated. They're denatured. In reality, they're a little more than just a cheap perfume made from various odorous plants, if that. A lot of these things are made in a laboratory. This also includes oils that are found in health food stores. So be really cognizant of what you're putting on your body and in your nose and, in your mouth if you're ingesting anything. Many people think that when we buy an oil that is labeled 100% pure, that they're getting good oils. Pure, unadulterated essential oil is very hard to come by and can be very expensive, as some people say about Young Living. But I'll tell you, as being part of the distillation team, when you get done at the end of the day distilling those oils, you say to yourself, they don't charge enough for these. I mean, the work that goes into it, the amount of oil that you get out of the plant material, it's just mind-blowing. But Now brand can say that they're 100% pure lavender oil and have only 17% pure lavender oil and 83% propylene glycol, and not have the propylene glycol on the label. So that's pretty dramatic as far as, how adulterated that oil is. And the only reason I know that is because we had it tested in 2001 in Chicago. So one reason that this is, like I was saying, the distillation process is because it can take as many as 500 to 2,000 pounds of or more of raw plant material to produce just 1 pound of essential oil. And that's really the case for Mrsa oil. Mrsa takes 2.5 tons of plant material and it only produces less than a quarter cup. So that's why Mrsa oil is one of our most expensive oils. To maintain all of the therapeutic qualities, it must be extracted by steam distillation using extremely low pressure and low heat so as not to defile the quality of that oil. So let's talk about different definitions. Pure means that the oil was not diluted with a lesser quality essential oil. For example, lavender oil is often cut with a lesser quality lavandin, which has a very little or low therapeutic quality. Pure does not mean that it has no chemicals added to it. It can be 75% vegetable oil and 25% essential oil and still be labeled 100% pure. That's what I was talking about with the Now brand lavender oil. In the United States, you are only required to have 5% essential oil in the bottle to label it pure. That's why Now brand said it was a 100% pure organic lavender oil, because it had 17% of lavender in it. So beware if it says pure. Natural. This means that the oil was not adulterated with vegetable oils or propylene glycol or SD alcohol 40 or other chemicals. It was not adulterated with vegetable oils or any of those other things if it says natural. If it says complete, this means that the oil was distilled at low heat and low pressure so that all the therapeutic properties are there, and they have not been rectified or purified, which means stripped or redistilled. Some companies, and we know that, well, it may be the case in some of the higher competitive companies that they, let me put it that way, that they actually do 2 distillations so that they can get more oil out. And of course, it's going to be a lesser grade oil, but they mix that in and they may adulterate it as well. So you want to make sure that you don't get oils that are redistilled. Essential oils are often redistilled to make a small amount of oil go even further, and they can make more money that way. The problem is that when you redistill the oil, you lose the therapeutic properties because you're adding heat to it twice. It's like using a tea bag over and over and over again, right? An example is France is the #1 producer of lavender oil. Get this. In 1997, they produced 25 tons of lavender and 67 tons were shipped to the United States. That math does not add up. And Mrsa oil is another example. It's very hard to produce. Out of 52 pounds of pure Mrsa oil, 1,000 pounds were exported. And so you have to ask yourself, what's wrong with this picture? And, you know, I love the fact that I've documented this stuff and that I've had it for all these years. I can't remember the year that I developed this, but there are anywhere from 200 to 800 chemical constituents that make up a single essential oil. And when the oil is not distilled properly, you can be left with as few as 10. So there is a genuine and I thought an authentic or grade A, and these are the cream of the crop. Great care is taken at every step of the process. Seeds not from hybrids, that would be Young Living, of course. Chemical-free organic soil, chemicals never used on the plants in the fields, distillation by steam at low pressure and low temperature in upright containers, and no chemicals are ever used in the process. The time in the distiller is also important. For example, cypress oil needs to be distilled for 24 hours. Many companies will distill at higher temperature for a shorter time so that they can get more oil, but that will destroy the quality of the oil. The distiller must be no more than 50 miles away from the site where the plants are harvested, and it must have a gas chromatograph reading with an embossed seal that does not come from their own lab. Then, and only then, can they have the grade A on the label. Young Living oils are only grade A, and they've far exceeded the standards. The United States has no standards. So they met the AFNOR standards, which are the French standards of distillation and oil production. And they are one of the few companies in the world that grow plants from seed, distill, and bottle their own essential oils. If you're interested in what AFNOR stands for, it stands for the Association French Normalization Organization Regulation, and it is an agency that sets minimum standards by which the quality, safety, reliability, and performance requirements described in French, European, and international standards can be validated. With regard to essential oils, it exists mainly to dictate the standards to which the essential oils are held in laboratory analysis. That is the definition of AFNOR. So what's the big deal here? Many oils on the market today are totally synthetic. They're lifeless. Others that have real essential oil in them are doctored with synthetic chemicals to extend them or to punch up their fragrance. Not to mention the problems of chemical contamination in either the growing or the processing of the oils. Chemists have successfully recreated the main constituents and fragrances of some essential oils in the laboratory. And that's why I say some are 100% made in the laboratory. And so they can't even come near even a perfume oil. They're just fake. The bet that Walmart oils come under that heading of laboratory developed oils. They simply cannot fabricate anything with all the properties of a therapeutic grade essential oil. So why is that? These Franken oils, and I wanted to show everybody my t-shirt tonight. It says, people who don't use oils make no Franken sense. So these Franken oils lack therapeutic benefits for two primary reasons. Many essential oils contain molecules and isomers that are impossible to manufacture in the laboratory. And while their absence may not significantly affect the fragrance of the oil, it does impact the therapeutic properties. Also, it's impossible to create the frequency of a therapeutic grade oil in the laboratory. Frankenstein was, after all, just fiction, right? But whether it's synthetic or just junk oil, you will not get the amazing health benefits from them that you would get from a truly therapeutic grade essential oil. And you could even face significant risks. So what do they do? I want to tell you tonight that they contain antiviral, antibacterial, antifungal, and antiseptic properties, being powerful, powerful oxygenators. They help transfer oxygen and nutrients into the cells, thus increasing cellular oxygen and giving support to the immune system. Oils actually increase ozone and negative ions in your home when you diffuse or in your office, which will inhibit bacteria growth. It will help remove dust particles in the air, and it acts as an air filtration system. It also helps to improve body frequency. And there are so many good books that I had to read when I went to school. I read The Practice of Aromatherapy by Jean Volney. He was a doctor. He used it on the war fields, for used oils to heal wounds. The Aromatherapy book by Jean Rose, It's Okay. The Fragrant Mind. Valerie Ann Woodward was a really, she was a long ago author that did a really pretty good job. She didn't get into a lot of the chemical constituents, but it was pretty good. And Robert Tesseron used to be, I have other books that are much better, but To Heal and Tend the Body is a good book by Robert Tesseron. And he's British, by the way. Okay, so let's talk about methods of administration. A lot of people don't get into this level of detail, so we're just going to do that, right? The use of essential oils are advantageous due to their ease of administration. They have, number one, percutaneous absorption methods. In other words, they can be absorbed through the skin. They can be absorbed through inhalation. You can take baths in oils, and I highly recommend that with Epsom salts especially, or with our unscented bath gel. I like the scented bath gels as well, but I can add as much oil or as little oil and the kind of oil that I want when I use my unscented bath gel from Young Living. You can use compresses with oils, and there's internal usage as well, as you've learned about from me in the past. So let's talk about percutaneous techniques, administration of a substance through the skin. The most common methods using this technique is massage, baths, compresses, and topical application. You can just put the oil on your hands, rub it together, and rub it anywhere that you want. What this will do is it will induce the relaxation of muscle tissue if you have it in an aromatherapy massage. It will release stress of the autonomic nervous system. It's going to relieve mental fatigue, improve circulatory flow, reduce inflammation, and it's going to improve facial mobility of connective tissue, the fascia. those are the things like that connective tissue. Like if you have a back strap of beef, it's got that tendony kind of sinewy stuff. That is the fascia. So this is improves fascial mobility of connective tissue. If you have soreness in your outer thighs a lot, if you rub your fingers up and down your outer thighs and you have soreness, that is probably bound up fascia. So using oils and using a fascia blaster, which actually I can show you one because I use them. This isn't my small one, this is my big one, but it has little things on it like that, and then you just rub it on your legs with the oils on, and then that'll help break up that fascia. You can stimulate the lymphatic system with a aromatherapy massage to eliminate toxins as well. Okay, so the use of carrier oils, this is very, it's a question that a lot of people have. What kind of carrier oil? There are different kinds. Sweet almond is a good one. This is an excellent emollient for chapped, dry skin, and it actually mimics the sebum in the skin. Apricot kernel oil is very light and it's easily absorbed into the skin, and it's good for facial massage blends, and it's good for treatment for mature, dry, sensitive, or inflamed skin. Yes, Lori, do you want to ask a question? You can unmute yourself.
I'm sorry. I wanted to say, I wasn't writing that down because I'm kind of multitasking, but I'm listening to you. Is it going to be recorded where I could go back? And I didn't know about the sweet almond oil. Usually we just use jojoba oil or coconut oil, but I like what you said about that. It mimics the sebum.
Yeah, this is recorded. And Lori, I know you don't know, but let's see, I'm going to put in the chat while we're talking here. I'm going to put my YouTube channel name, and all of my classes are on YouTube. And so it's under my name spelled just like this, Christina Campbell. Okay. Okay. Awesome. Thank you. All right. Good. We're good. Yeah. So the avocado oil. This is a heavier oil, so it soothes the skin. It's ideal for dry, mature, climate damaged, undernourished, and aged skin. I do like all of these oils actually. Evening Primrose, I used to suffer with bad skin, really bad skin from Gulf War, and they had diagnosed it with as atypical rosacea, atypical dermatitis, atypical this, atypical that. So I would use Evening Primrose. It treats eczema, psoriasis, and rheumatoid arthritis and PMS. Evening Primrose is a nice oil. It usually comes in capsules. So you prick the capsule and then you blend it with your oil. Also, jojoba oil. Jojoba is probably your heaviest oil. It's like a liquid wax. But it is naturally moisturizing and it's healing to all types of skin. So let's now talk about dilution rates with these carrier oils. If you're going to dilute, and I dilute probably more than most people because of my skin sensitivity. So the rule of thumb is ml of essential oil is approximately 20 drops. So if you were going to do 1 to 3% dilution, you would have, so you have, if you had a half a milliliters, 10 drops, add 3 drops of essential oil to that. So 3 drops to every 10 drops of essential oil is basically the dilution rate. To prepare a 3% dilution massage blend to 100 milliliters or 3.4 ounces of carrier oil, add 3 milliliters. Now, you know that we have 5 milliliters and 15 milliliter oil bottles. So about 60 drops to 3.4 ounces of carrier oil. Or if you want to half that, 50 milliliters of carrier oil to 30 drops of essential oil. So here's some carrier oil dilution percentages. In 1 tablespoon of carrier oil, if you were going to do a 1% dilution, you'd have 3 drops. If you're going to do a 4% dilution, you're going to do 12 drops. And then it just goes up from there as far as how much carrier oil you have. So just rule of thumb, 1 to 3% should be the essential oil to the carrier oil. Okay, moving on. Inhalation. Let's talk about inhalation.
Quick question, Christina.
Yes, Gail.
All I have is your intro page. I have seen no screenshots since then.
What?
So it says, you know, change in the nursing home setting, your number down at the bottom. That's all I've had for on my main screen.
Is that true for everybody?
Yes, Cynthia. Yes, Cynthia, I have the same thing.
Oh my
Yes.
gosh.
Yes,
It's true for me too.
yes.
Okay. What do you see now?
It's the same thing.
I'm saying the same thing.
It just says Christina Campbell has started screen sharing, and that's it. It's just the
Yeah,
circle
black
going
screen.
round and round
Yeah.
and round. I mean, I've even restarted my phone and everything.
I wish somebody would have said something earlier because I went through all those slides, but you probably didn't know and you probably thought it was you. Okay, let's see what this does. Do you see a body?
Oh, yes, thank you.
Oh, I'm
Yes.
so sorry. So yeah, okay, went through all these slides and we're going through aromatherapy massage. We're going through types of carrier oils, dilution rates, dilution oil table. And now we're going to talk about inhalation. Anyway, it is what it is, right? Okay, so let's talk about inhalation. The olfactory senses are directly related to the limbic region of the brain, and that is the frontal part of the brain. Essential oils, when dispersed into the air, can disinfect and purify and kill mycotoxic fungus, black mold. That would be the Thieves Oil Blend, by the way. Commonly, essential oils are inhaled for the treatment of respiratory conditions like RC oil blend. And according to Dr. Jean Volney, essential oils that are vaporized will kill 90% of airborne microbes within 3 hours. 90%. Thieves. And I've always taught, diffuse thieves when your kids come home from school and diffuse thieves before they leave in the morning, because they're carrying things and they're bringing it back. So make sure you're diffusing for at least 30 minutes in the morning and 30 minutes at night, but longer at night when the kids come home. Okay, so essential oils could stamp out the spread of MRSA. This was written way back in 2004. It was revealed that 3 essential oils killed MRSA. That's methicillin staph-resistant aureus and E. coli, as well as many other bacteria and fungi within just 2 minutes of contact. The reason essential oils are so effective is because they're made up of these complex constituents, which the MRSA and other superbug bacteria find very, very difficult to resist. The problem with current treatments is that they are made of single compounds, which MRSA relatively quickly becomes resistant to. So treatment is only successful in about 50% of the cases. And that's why we have superbugs today. When you try to kill these bacterial or viruses with antibacterial chemicals, they become resistant, and then they become superbugs. And then we don't have any chemical that can kill them, so we get a stronger chemical. MRSA is often carried inside the nose, which means that patients often have to insert treatments up their nostrils, whereas these essential oils can be simply inhaled to prevent the patient being at risk. This was written by the largest cancer treatment in Europe, the Withington Manchester in the UK, the Christie Hospital, actually. And that's one of the reasons that I use nose swipe, you know, with the Exodus 2 and the Egyptian gold in the animal sense up my nose, because that's going to protect me from any of these airborne bacteria or viruses. So you want to vaporize or you want to diffuse, and micro diffusers are the best if you're really trying to remediate heavy duty illness. And the only one that we have right now is the Aroma Lux. This ensures that fine particles of the essential oil are being dispersed directly into the air. And the smaller and the finer the particles, the more readily absorbable they are to the lung, in the lung tissue. So this is really important to keep us healthy during this negative respiratory season, right? So these are some studies that have been done. Here is a comparative in vitro activities of topical wound care. And basically, it's saying, and I'm just going to jump right down, you can read all this stuff, but it says that they were using on MRSA, they were using an over-the-counter topical wound care product to see if it could prevent these MRSA infections. The study found that the topical agents demonstrated variable activity against the 4 strains tested, but that benzethonium chloride and essential oils were more rapidly and completely active than the other agents tested. So this is with wound care associated with MRSA, and there's a lot of that in nursing homes. So that's why I was teaching that in nursing homes. So here's a protocol for wound care. And I will tell you that New Jersey, nursing homes in New Jersey and in New York used Young Living essential oils for wound care and had amazing results. And I actually have data on that, how many days the wound had been, like if the wound had been for 3 years, and it took 60 to 90 days once they put lavender and frankincense into the wound. And they did it straight or neat on some of the really bad wounds. Unless the person had a sensitivity, then they would dilute it. They applied with poultice on wounds that were not healing, and the different oils that they used were thieves, lavender, peppermint, and frankincense. Other essential oils that are effective against methicillin-resistant Staphylococcus aureus, or MRSA, are patchouli, tea tree, geranium, lavender, grapefruit seed extract, which we may have in some of our products, but we don't actually have that essential. We have the grapefruit oil, not the seed extract. These were used singly and in combination to assess their antibacterial activity against 3 strains of Staphylococcus. The study demonstrates the potential of essential oils and essential oil vapors as antibacterial agents and for the use of treatment of MRSA infection. So let's talk about lavender for a minute, because lavender is good for behavior and it can control, it can help with sleep. The University of Miami researchers found that inhalation increased the beta waves in the brain, suggesting heightened relaxation. Research shows the reduction of mental stress with lavender scents. Studies show the use of aromatherapy with hospice patients, that it decreases pain, anxiety, and depression and promotes increased sense of well-being. Lavender oil was also used as a treatment for agitated behavior in severe dementia patients, and lavender oil inhibits immediate type allergic reactions. I have taught this over and over and over. If you have seasonal allergies, if you have hives for any reason, use lavender. And the best way to use it is putting it on the tip of the tongue and raising the tongue to the roof of the mouth. That will allow it to go directly into the brain and in the sinus cavity where you may be having a seasonal reaction. If you're reacting to dander, the thing is that the consistent use of things like lavender will actually change the damaged DNA that's causing the overproduction of histamine in the first place and heal that allergy. If you've been allergic to something for 36 years, it may take you 18 months of constantly using lavender oil before that allergy is gone. But if you're consistent and you do it daily, you will build your system up to actually heal that damaged DNA. It's what God's oils do. They heal. God uses these oils to heal. So here are some medical uses of lavender. As far as using it on the skin, that's what integumentary means. Dr. Gatpase, who was the father of aromatherapy, by the way, he was a scientist, he was a chemist, he was a perfumer. He founded lavender's healing properties. I think it was in 1910 when he accidentally used lavender essential oil on 2nd and 3rd degree burns. I tell you, I don't know if she would be against this, but I got a picture of somebody, I won't tell you who, so that will help. Somebody who was burned very badly. I don't know how well you can see this. See the burns on her forehead? This was a couple of days ago. Her mother used lavender oil. This was, see the improvement? And then yesterday, see if, well, that's just an incredible improvement compared to what it was. And that's with lavender oil. It's just amazing. It has antiseptic, analgesic properties. For the nervous system, it decreases sympathetic dominance and assists our response to unproductive stress of any kind. Use lavender oil, people. It exerts a sedative effect or a stimulant action depending on what the body needs. That's the beauty of God's natural things. They are adaptive. Oils are called adaptogens. They adapt to what the body is calling for. Regarded as the essential oil of choice for insomnia, especially when there's mental stress and anxiety. It's also good for the reproductive system. It relieves PMS pain. All you have to do is massage the essential oil with a hot compress on the lower abdomen and use during labor to reduce maternal anxiety. The respiratory system, it's beneficial for asthma and uncontrolled anxiety, especially asthma in reference to a nervous origin. For skin care, it's antiseptic. It's used for all skin types. You can use it as an insect repellent. You can use it to treat insect bite itchiness because it promotes tissue repair. This is an abstract that was written, 91 essential oils, each distilled from a single plant source, and 64 essential oils obtained from a commercial source were screened using the disc diffusion assay for inhibitory activity against Mrsa. Of the 91 single essential oils, 78 exhibited zones of inhibition against Mrsa, with lemongrass, lemon myrtle, mountain savory, cinnamon, and Melissa essential oils having the highest levels of inhibition. Of 64 blended essential oils, 52 exhibited inhibitory activity against Mrsa with RC, which is a combination of myrtle, Eucalyptus globulus, Eucalyptus australiana, I can't say that right, Eucalyptus citrodora, motivation, which is a combination of Roman chamomile, ylang-ylang, spruce, and lavender oils, and longevity. Now we can still get the longevity oil, we just can't get the longevity capsules right now. This is a combination of frankincense, clove, orange, and thyme oil. These blended essential oils having the highest inhibitory activity. These results indicate that essential oils alone and in combination can inhibit Mrsa in vitro, and an application of these results may include the potential use of essential oils as alternative therapy for various diseases sustained by S. aureus Mrsa. Immune protection. Researchers suggest that certain essential oil constituents mimic human immunoglobulin. Essential oil constituents may also elevate levels of leukocytes, which are white blood cells, and lymphocytes that stimulate the immune system. And I told you in classes before that lemon oil has been the #1 oil to increase the production of leukocytes and lymphocytes in the bone marrow. So we look at Young Living single oils of chamomile will do this, clove, mountain savory, lemon, and raven sarah. And the Young Living blends that will do this is Thieves, because it has lemon in it. RC, Melrose, Digize, Raven, and Endoflex. All of these are going to increase your immunity or mimic the human immunoglobulin. So it's going to make us more resistant to disease. Lemon is a #1 oil for infection control. And actually recently, like last night and the night before and the night before, I've been diffusing these 3 oils: lemon, stress away, and peppermint. And I love it. I absolutely love it. So that's what I've been diffusing at night in my bedroom. Medicinal uses of lemon oil will blow your mind. For circulatory, it tonifies circulation, reduces blood viscosity. In other words, it's a natural blood thinner. It breaks up arterial plaque in arteries, and it reduces cholesterol. That's why I say you should be drinking lemon oil in your water every single day. You should be diffusing lemon. You should be drinking lemon, putting it all over you, lemon. But you need to put it where the sun doesn't shine, because it is a photosensitive oil. So if you're going to work outside and you put lemon on your face, just beware. You're going to have an issue. It's good for immunity. It's antimicrobial. And in research done by Dr. Jean Volney in 1888, they vaporized or diffused lemon oil, and it destroyed meningococcus bacteria in 15 minutes, tuberculosis in 20 minutes, diphtheria in 20 minutes, and Staph aureus in 2 hours, and pneumonia or pneumococcus in 3 hours. It kills this stuff, guys. And the studies have been out there. It kills diphtheria in only 0.2% dilution, 0.2. So if you're diffusing, it's going to kill it. Some of the medicinal uses of lemon are, it's a lymphatic detoxifier. I've talked about that before, right? It's a mild detoxifier. It's anti-cellulite. Rub it all over those thighs, ladies. It's good for skincare because it's astringent. It counteracts overproduction of sebum. One of the greatest things that you can do for teenagers is take a dampened organic, the round cotton pads, dampen it and put 1 drop of lemon and have them use it like what we used to call the Stridex pad. It will clean the pores. It will tighten the pores. It tones the skin. It tones aging skin. And it's antibacterial, so it's great for treating boils and acne, treating warts if it's undiluted. It's a phenomenal oil, lemon oil. In Oriental medicine, the benefits of using lemon oil were that it moves blood. It stops bleeding. So broken capillaries, varicose veins, hemorrhoids, nosebleeds, internal hemorrhaging, and hypertension can be treated with lemon oil. It rectifies the skin, mouth ulcers, boils, abscesses, freckles. I like my freckles, actually. Wrinkles, broken capillaries, itching, acne, and rashes. Lemon oil. Try it for rashes. Take that Stridex pad, dampen it, put a drop of lemon on it, and rub it all over that rash. In fact, my girlfriend right now had a bad reaction, and the doctor said it was eczema. I don't think it was, but she said it was like leather on her face. And she started putting straight lemon oil on it, and it softened it right up and started clearing it up. Lemon also rectifies the joints. It produces or promotes tissue repair, connective tissue weakness, infected wounds, and liver congestion. It helps with high cholesterol, arteriosclerosis, gallstones, stones in the urinary tract. If you have kidney stones, they can be very, very painful. If you're getting kidney stones, you're not doing enough K and B, and you're not doing enough lemon oil. Nausea, headaches, irritability, and insomnia. Lemon oil is a miracle. And it's really inexpensive. So here's another one, Staphylococcus aureus or Mrsa and wounds with tea tree oil. It says Melaleuca alternifolia, that's our tea tree oil, has demonstrated promising efficacy in treating these infections. Tea tree oil has been used for centuries as a botanical medicine and has only in recent decades surfaced in the scientific literature as an anti-inflammatory, as a promising adjunct wound treatment. Tea tree is antimicrobial, anti-inflammatory, and has demonstrated ability to activate monocytes. This is really, really great. And when I talk about the immune system and I talk about all the T cells and the killer cells, check out my healthy immune system on YouTube. If you haven't got in on that class, you're going to find out that we need to activate these monocytes. We need to activate these lymphocytes and leukocytes, produce more of them. We need to have our thyroid in good health so that it can mature those T cells. There are few apparent side effects to using tea tree oil topically in low concentrations, especially with contact dermatitis being the most common. So that's people who have skin sensitivities, right? But tea tree oil is a good oil. So here are a whole list of anti-staphylococcal essential oils. Tea tree, manuka, which we have, peppermint, oregano, clove, cinnamon bark, Eucalyptus radiata, Eucalyptus globulus, Spanish oregano, lemon, Ravensara. I love Ravensara, and I love Raven. I love Raven. Thyme, lavender. Raven is actually a blend with Ravensara in it, and I love, love, love it. I think it has lemon in it too, so it'd be a great blend. It should have been in this list, right? But these aren't all single oils. But Raven should be on here. Lavender, juniper, lemongrass, geranium, chamomile, cypress, thieves, and RC. These are all great. Let's talk about peppermint. Peppermint for improved alertness. It's also great as an analgesic. It's used in liniments for relief from muscle pain, lumbago, bruises, contusions, joint pain, and insect bites. You know that peppermint is great for digestion, dyspepsia, nausea, stomach pains, diarrhea, and gas. It's good to relieve travel nausea. It's great for the lymphatics. It has a special affinity with blood and lymph. That's why I've been using more peppermint lately. It's vasoconstrictive, and its vasoconstrictive effects increase blood flow. So it increases blood flow to circulate to that area that might have pain. Did somebody have something to say, or should I put you guys on mute again? Okay. You can always unmute yourself. Okay, so the medicinal uses are, it's beneficial for colds and flu associated with fever and headache. For the onset of a cold, like for sinus congestion or infection and inflammation, I just wipe it right up my nose. Mix it in with a little rose ointment or a little animal scents, and that'll just be much better. For skin care, it relieves any skin irritation or itching, but should be used in a dilution of 1% or less, or you can make the irritation worse. So dilute it. Steam treatment with peppermint to cleanse and decongest the skin. Also, thyme oil is really good for that, especially if you happen to come down with any of the seasonal flus, quote unquote. Putting thyme oil in a bowl of boiling water, putting a tent over your head and breathing that in through your nostrils will really help. Thyme oil, thieves, peppermint. All of those are going to be good for that seasonal flu. It cools the skin by constricting the capillaries. For headaches, this is bar none the best thing that I can use for headaches. University of Kiel did some research that it blocked headache pain in a double-blind placebo-controlled crossover study. It works much better for you than aspirin. Okay, I have a nurse on here, Lori. Thank you for sharing that with me, Lori. This is a great book. This was written by Buckle, and it's the role of aromatherapy. This is not the book I'm thinking of. Role of aromatherapy in nursing care. Aromatherapy is the fastest growing of all complementary therapies in the United States. Although aromatherapy has been used by the public for recreation for thousands of years and by nurses throughout the world during the last 15 years, it is only in the last few years that aromatherapy has become recognized by the United States state boards of nursing as a legitimate part of holistic nursing. Aromatherapy is now set to become one of the most popular tools that nurses can use to enhance their nursing care and simultaneously empower themselves. There has been an increase in interest in the complementary therapies among the general public and healthcare practitioners in recent years. Nurses integrating complementary therapies into their practice are not always adequately prepared due to the diversity of the therapies and the duration of the courses. Here is oregano, cinnamon, and savory essential oils, mountain savory essential oils against cell membranes and Listeria and E. coli. So this is basically saying that two pathogenic foodborne bacteria of E. coli and Listeria used. They were gram-negative and gram-positive bacterial models. They treated them with essential oils, and it destroyed the membrane of the bacteria and killed them. However, it induced more depletion than the cinnamon oil, the oregano, and the mountain savory, and an increase of extracellular ATP concentration was observed when this oregano and savory oils were in contact with E. coli and listeria. So I'm just telling you that it's really good against these bacteria. They affect the psyche. The aroma of essential oils triggers physiological and psychological responses, and they lift our moods, aid in alertness, calm aggressive behavior, and help to deal with trauma. Essential oils also lower anxiety, increase memory, and affect our dreams. Young Living essential oils like lemon, lavender, orange, bergamot, rose, and jasmine. But Young Living's blends like Awaken, Joy, Believe, Harmony, Citrus Fresh, Trauma Life, Sarah, Release, Magnify Your Purpose, Peace and Calming, and Into the Future and Highest Potential also work. The only one I'm going to talk about tonight is Joy. It's a very uplifting blend. You can use it topically or for aromatic use in a diffuser. You can use it as a cologne or a perfume. I apply it over my heart. I dilute mine, about a 3% dilution. You can get a body massage with it. You can dilute it with V6 or any other carrier oil that we talked about tonight. Here is a study on the effects of aromatherapy on pain, depression, and life satisfaction of arthritis patients. Let's jump right to the conclusion. The result of this study clearly shows that aromatherapy has major effects on decreasing pain. The oils of lavender, marjoram, eucalyptus, rosemary, and peppermint, blended in portions of 2 to 1, mixed with carrier oils that were composed of almond, apricot, jojoba, and then blended together. They were found to be effective on decreasing pain and depression levels. Based on their findings, we suggest that aromatherapy can be a useful nursing intervention for arthritis patients. So what would you use for natural pain relief? Essential oils can be gently massaged into sore and tired muscles or made into a compress and applied with heat. And they may also enhance the production of endorphins and activate neurotransmitters in the brain that actually help to alleviate pain as well. So the oils that will do that are single oils like Idaho balsam fir, black pepper, peppermint, ginger, lavender, palo santo, and wintergreen. Young Living blends are Deep Relief, Roll On, Panaway, Motivation, Sacred Mountain, Aromaseas, and Endoflex. So let's just talk about one of those right now. Let's talk about Panaway, about taking the pain away. It's made with helichrysum, which have noted that this oil helps to regenerate tissue and improve circulation. It's really good for nerve damage. It has wintergreen in it, which is an analgesic. It's similar chemical constituent to cortisone. It has clove in it, which contains eugenol, often chemically what dentists use for numbing. It's a very strong analgesic. It deadens the pain. And it has peppermint in it. It acts on the superficial circulatory system. 1 to 2 drops topically to the painful area. You can do that straight. Or 3 to 6 drops diluted in a tablespoon of carrier-based vegetable or nut oil. Here's some more research on from the holistic nurse practitioners in 2009. Today's investigation may provide the key to eradicating degenerative inflammatory disease, infectious disease, and carcinogenesis. So folk and traditional therapeutic use of the essential oil of lavender for pain, infection, relaxation, and sedation dates back centuries. Current research focusing on the inherent synergism of Lavandula augustifolia demonstrates the potential for future applications. This was tea tree again for in vitro Mrsa, Staphylococcus, and how it destroys the biofilm or the protective covering of the bacteria. Clinical aromatherapy and AIDS. Clinical aromatherapy is the use of essential oils for expected outcomes that are measurable and is a therapy that is used as part of the nursing care in Switzerland, Germany, Australia, Canada, and the United Kingdom, and in some places in the United States. Essential oils are steam distillates obtained from aromatic plants, and these volatile extracts have been used for years by French hospitals against airborne bacteria and fungus. And as antimicrobial agents, essential oils may be appropriate in HIV/AIDS for specific opportunistic infections. Aromatherapy can also alter perceptions of chronic pain, help maintain skin integrity, and is useful in stress management. Do not expect to get the same results using an essential oil or an aromatherapy product that is not of the highest quality available. Only 2% of all essential oils distilled in the world are therapeutic. Of course, I use and recommend only Young Living essential oils. I'm going to end this presentation tonight with a disclaimer. If you are in need of medical attention, please consult a professional healthcare provider. This presentation was designed to help promote an understanding of the use of natural aromatic plants in the pursuit of well-being, whether emotional, physical, or aesthetic. All right, that is the end of my presentation.
That was fantastic. Thank you so much.
Oh, you're very welcome. I'm going to stop